Just confirmed I am pregnant. What should I do? This is one of the questions I got this morning. If you confirmed you are pregnant, the next thing to do is to start taking your folic acid as soon as possible. If you have been taking it before you got pregnant, you need to continue, because it is usually at these early weeks of the pregnancy that this folic acid is very, very important, because this is the period your baby's vital organs are forming. So if you skip or miss taking folic acid at these early weeks of your pregnancy, your baby is at risk of having what we call birth defect. Okay. Number 2, start making preparations to go and register for antenatal as soon as possible. Now, registering for antenatal this early will help to inform you on things to do and things not to do in this pregnancy. It's still at this antenatal booking that blood screening, that is, they are going to run some blood investigations for you, and if at any point they find out any infection or any disease that could be transmitted to your baby, they are going to place you on a medication, okay, that will help your baby from contracting that particular infection or disease. So this is why it is important you register for antenatal as soon as possible. Now, after that, you have to start staying healthy, start practicing healthy habits. Okay, you have to start eating balanced meal, mind the kind of things you eat, avoid raw and undercooked food. If you're the type that loves alcohol, please, you have to stop at this point, because no amount is safe during pregnancy. Don't smoke, don't take recreational drugs, stop staying around smoker or in a smoking environment. You have to stay physically active and drink enough water. 5, if you have been managing any particular health condition before you got pregnant, you are placed on any drug before this time, please, that medication, those drugs you're taking need to be reviewed by your healthcare provider to know if they are actually safe for you during pregnancy or not. Please remember, you are pregnant. This is not the period that when you fall sick, you quickly go to the pharmacy or the chemist to purchase any drug of your own choice and start taking. Please don't do that. At this point, if by any means you get pregnant, you fall sick, it is important you let your healthcare provider know. Don't just go and purchase any drug and start taking. Okay? During these early weeks of pregnancy, miscarriages are very, very common. This is why early antenatal registration is very, very important. When is the right time for a woman to stop breastfeeding her baby? This is one of those frequent asked questions by postpartum mother. Breastfeeding can be very demanding. It is not just you breastfeeding because you want to save cost. It requires a lot because you actually give a lot. According to the World Health Organization, it is being recommended that a woman should breastfeed her baby exclusively for the period of 6 months. After 6 months, you're going to complement that breastfeeding with food. And this is going to take place for 2 years. For some reasons, some women may not be able to keep up to this, okay? Some women may not be able to afford, because breastfeeding, like I said, is very demanding. It requires you to eat healthy, okay? Not just you eating, you should eat balanced diet, because as you're breastfeeding that child, you're giving out eventually everything that child needs for a proper growth. You're giving out water, you're giving out essential vitamins, minerals, proteins, fats, carbohydrate, lactose, living cells, enzymes, and hormones. You're giving out all of this to your baby. Now, why you need to eat healthy, you need to eat a balanced diet? It's because when you give out these things, you should also have some left for yourself, for your own body. Okay, so the proper recommendation is you feed your baby exclusively for the period of 6 months. After 6 months, you can augment with a complementary food or normal food, and that is going to take place for 2 years.